So my name is Damien Weber. I'm chairman of the Center for Proton Therapy and the Pulsar Institute, which is located in Switzerland. So there is a huge increase in the number of centers constructed in the world. It started in the 2000 in the United States. We have the same trend now in Europe, where a number of proton facilities will come in line this year and these coming years. And of course, there's this new proton center at Apollo in Chennai in India. So we're talking about 5 to 10 new centers coming online. There will be 2 centers in the UK. One actually will start delivering the first treatment in December. There will be 3 to 4 new centers in the Netherlands. Actually, one has started treatment in Groningen, which is the north part of the Netherlands, a couple of months ago. There will be 1 new center in Belgium. So we are talking about a number of new facilities coming online. So there has been a huge advances in photon therapy, so what we call conventional radiotherapy, and the vast majority of patients can be treated very appropriately with these techniques. And by the way, these techniques are usually completely embedded into the treatment against cancer in India. So the vast majority of patients can be treated appropriately with conventional radiotherapy. However, there are a number of patients with tumors that are in direct vicinity of critical structures that are radiosensitive, and for which you need to give a high dose of radiation in order to obtain cure. Or actually children that are very sensitive to radiation and are very sensitive to making actually complication to the treatment. These patients would benefit possibly from proton therapy. So we're talking about skull-based tumors, difficult geometry in 3Ds, spinal tumors, and of course children. We know that children after cancer treatment have a number of complications of treatment, not only radiation but also chemotherapy. We know that these children are smaller, less intelligent, less integrated into society, unless we can go on and on and on. And the aim here would be to decrease the likelihood of any complication due to treatment. The challenge is to bring patients to these proton therapy centers. As I just mentioned, there are only a couple of centers in big countries. The referral time can be quite an issue. So you have to be very organized, and the network has to be optimal. In some patients where we need immediate treatment, such as high-grade brain tumors, it could be really a challenge. The other challenge is that proton therapy is very resource intensive. So in terms of operational costs, in terms of number of FTEs that has to man the centers. So that is really something that is of prime concern. We're trying to make industry and technical platforms such as PSI are trying to make proton therapy more affordable with more compact solutions, but the time will tell if we will be successful. So we did a survey last year in the European particle centers. The resources vary quite a lot from one center to the other, depending if they are embedded into other cancer centers. But if you take in comparison to conventional radiotherapy, yes, indeed, there are a number of additional resources necessary in order to man these centers. The cost, well, it all depends very much on the healthcare system that we're talking of. And if you have a fee-for-service system such as the US, the cost will be horrendously more expensive. Whereas if you are in a more social network-like system, such as in Europe, the cost would be decreased. The additional cost in comparison to photon therapy is anything between 1.5 and 3.5 or so, depending on how the photon actually treatment are billed and how the proton therapy are billed by the national health authorities. I think the future for proton therapy is bright, but it will. The vision differs among vendors and people that actually utilizes these centers and health professionals. I think that there was a general a consensus conference in Stockholm a couple of years ago on pediatric oncology, and the question was, is proton therapy going to replace completely photon therapy? The answer is probably no. So proton therapy will be a solution for a given patient, given with a particular tumor that is, as I just mentioned, abutting difficult and radiosensitive organ risk, or for children. I think that will be the niche in the future.